Bipolar 1's when someone's shifting between incredibly high, euphoric moods, down to normal, then down to depressed. When they're in the high or manic phase, they can have incredible energy, have little need for sleep, and can talk fast or a lot. They feel invincible like a superhero and can take on tons of projects and make impulsive decisions. They may even engage in risky behaviors like risky sexual encounters, excessive spending, and substance abuse. They can also have hallucinations, delusions, or just illogical thinking. They usually stay in this phase for at least a week and then cycle down to depression for at least 2 weeks. And they can go months or even years without any symptoms at all. The causes aren't entirely known yet, but the risk of having it's higher if your parent or sibling has it. It typically starts in the late teen years and then gets worse over time. And many people have success managing it through the combination of both medication and therapy.
Here's the top 3 warning signs for bipolar disorder. Number 3, they're not sleeping. We see their sleep gradually go from, let's say, 8 hours to 7 hours to like 3 hours or 4 hours. They can go multiple nights without this. They don't feel like they need sleep. They feel energized in the morning without that. And they say that they haven't slept, but they feel absolutely fine. Number 2, they start talking fast. In bipolar, you often have like a rapid series of thoughts. So like their thoughts are racing, they're thinking a lot quicker, and they're talking a lot quicker too. We call this pressured speech or flight of ideas. It's like difficult to interrupt them because they just want to keep talking and talking, and they might pause to hear you, but then they'll just keep talking and talking again. And number 1, they're impulsive. They start doing risky things, things that they might normally not do. They start going on shopping sprees. They start driving really fast. They start hitting up their ex again. They start having sex from bars with like random dudes. For example, a patient that I had, she started getting manic again. She was working as an EMS driver. And so she was taking a lot more shifts, doing more night shifts, and, like driving really fast on the EMS. And the reason they found out was because she was driving so fast. She had her partner. Her partner made her stop driving and took her to the hospital, where then they diagnosed her with bipolar disorder. So if you've seen this either in yourself or someone else, make sure to get psychiatric help.
Okay, so before I start this, in no way am I saying that any celebrity that we've been speaking about has bipolar, but I'm going to talk about bipolar. So when people have a manic episode in bipolar, when they're right up here, I want you to imagine the best feeling that you've ever felt in your life. So a time in your life where you felt 10 out of 10, you were confident, you felt amazing, you were full of energy, you were so happy and elated, and nothing that anybody could say to you would put you down. Okay, imagine that, and then multiply it by 10. And now let's imagine that all your friends and family and all your work colleagues and everybody else is saying, you're not well, this isn't right. And you, in your elevated mood, say, why are they saying that? I feel great, this is fantastic. Because you have something called lack of insight. So you don't even see that you're unwell, and you're going out and you're spending all this money, you're believing in things that you think you can do but you can't, and everybody around you is telling you that you're not well. Would you want to take a medication? Probably not, because you don't think there's anything wrong with you. And that is the problem with people who are manic and in bipolar, is that they think there's nothing wrong with them. And it's really terrifying. I've had patients before, and I feel really sorry for them because they believe there's nothing wrong. And they've got everybody in their life telling them they've got something wrong with them, and they do need medication to control that. But yeah, it's really, really sad. I don't think people realise that people who are manic in their bipolar don't know that they have a problem. And if you were feeling great, would you want to take a medication to make you feel not great? Probably not.